Bryce, would you like to introduce our program?
Sure. From the group PAVE, Paws Assisting Veterans, we have Christina Mulick with us this week.
Well, thank you for having me. And this is my friend Scout. He's a little hard to see. I propped him up on some folding chairs just because he's normally a lot lower on the floor. But I'm really happy to be able to talk to you all. And I've never done a presentation like this over Zoom. So this is really fabulous that I can talk to you from Philomath instead of having to drive to Forest Grove to do this in person. So I'm happy to answer any and all questions that you can think of as I go along. Please take note of those and we can do some Q&A at the end, I think. Is that correct, Bryce?
Yes.
Awesome. So I've got a presentation and I'm going to give you the overview of what we do, what our next steps are, who we serve, and hopefully you learn a lot about our service dogs. So the overview is I'm Christina Michele. Actually changing my name to Liz Sardi. I just got married right before COVID, so a lot has happened. But I'm very excited. I've been working with PAVE for a number of years in different capacities. I'm sure Lucas has some familiarity with that as we exchanged emails in the past. I was actually the executive director for a couple of years and took a year off so I could move to Corvallis area. So I've got a lot of history with PAVE. And so there's so much, oh my gosh, so much I could share. But the overview is that PAVE was started in 2010 by Dr. Michele Nelson, who's a professor at Linfield full-time. And we were really pleased a couple of years ago to receive our accreditation as a program through Assistance Dogs International, which is highly exclusive. I believe there are only 3 or 4 programs in the state that are accredited, and we're only the second one that serves veterans. So that's very dear to our heart that we have this little niche. And it means that we work at a much higher standard than other people who say they train service dogs. Just like almost any field, if it's a little unregulated, people can hang up a sign and say they do it. And we want to provide the best service we can for our veterans, making sure that everything is HIPAA compliant, best standards of practice, most ethical treatment of dogs and clients, etc. So our mission is veterans, thus Paws Assisting Veterans is the name. We serve veterans with PTSD diagnosis, but we also serve veterans who have TBI, generalized anxiety, problems that are combat related and non-combat related. So we have a very broad spectrum in that regard, that we have veterans from different walks of life, certainly a very diverse smattering of service tours, branches, age ranges, family statuses, etc. So it's a really amazing group of people we get to work with, and I just feel honored to work with them every week. The different ones that I get to interact with, and the dogs we get to work with too are just phenomenal creatures. So one of our specialties is that we only serve the Pacific Northwest. We do have a few veterans who have moved out of the area, and we continue to provide services for them in the best ways we can, but almost all of our dogs are in Oregon. We have one veteran who recently moved to France, which is giving us a few challenges. But yeah, they're almost all in Oregon, Washington. We have a few in California. And I think one that's actually going to be moving to Arizona soon with her dogs. So it's really exciting to see the variety of ways people's lives change with the service dog. And I'll explain more about how the dogs help and what they're trained for as I go through this. Let me think here. Sorry, I'm using my slides to help guide me. So our service dogs are primarily labs, golden retrievers, and golden retriever lab mixes. They just have the best temperaments and they're really easy to manage and train, especially for a disabled veteran. Many of them can't handle a very high stress dog. We don't want to give them a dog that has anxiety, that's overly aroused, that's hypervigilant, because those are oftentimes challenges that the veterans themselves need help with. So we try to pair them with a really balanced dog that helps to be a little bit more social lubrication, if you will, getting them out in the community, going back to places that they used to frequent that are really hard for them to go now, whether it's, going back to a church or going back to their gym or school or work. And a lot of them just want to be involved in the community in groups like Rotary and other volunteer services that they can do for other veterans and things like that. Because we have such a narrow niche. We source a lot of our dogs from the Guide Dogs for the Blind program, which has been an amazing partnership for us because it really cuts down our training time and our program expense. There are a lot of dogs that don't make the final cut for Guide Dogs, most prominently seen in the Pick of the Litter movie, became very popular. And so the dogs that don't make the cut for a guide dog are oftentimes sourced to other service dog programs that have different needs. So for instance, Scout came to us because he had inconsistent relieving schedules. If you really are visually impaired, it's hard to have a dog that doesn't always go to the bathroom at the same time of day. So for that reason, Guide Dogs released him and he came to us. He's one of our younger dogs, but he's doing phenomenal work at his service dog task for a veteran. So it becomes really an amazing partnership as we get dogs that are fully health screened, bred for temperament, and are already a little bit older as they've usually had a little bit of training. So we spend a great deal of time refining the training on each of these dogs. A lot of them come, I want to say, a little after a year from Guide Dogs because they've done a lot of training to see if they can make the dog work out for guiding a blind person. But then we spend a lot more time after they come into our program refining the training and teaching skills that are very specific to our clients. So we don't place a dog generally that's younger than 2 years of age. And we've had some that were closer to 2.5, just depending on what skills the dog needed, finding the correct veteran to match them with. And the dogs have to be mature. We're not going to take a disabled veteran who's a paraplegic, for instance, and say, here's your dog, by the way, it's 9 months old and it needs a lot of skills. We try to do the matching after the dog is trained so that the veteran knows exactly what they're signing up for. And then we provide aftercare and follow-up services as we need to. But the dog is really ready to go. It's really ready for the environments it's going to be in. Could get on an airplane, go to Costco, navigate a therapy office, all of the above, and be completely set. We have currently 3 of us trainers on staff, and we normally don't have any more than 5 dogs in training at a time. That's just the nature of the way the organization was founded and designed. Dr. Nelson really wants to make sure that the dogs live in trainers' homes and aren't in kennels barking, learning bad behaviors, and just being kind of uncivilized. We want dogs that are really refined, very bonded to people, clean, working on daily skills like waiting at doors, waiting for their food and things like that. So we don't have the setup you'd think of if you've ever been to a boarding kennel or a guide dog facility where there's just rows of dog runs, which is why he's living with me currently while he's finishing his training. Let's see. So the skills we teach our dogs. A service dog is defined as a dog that can provide a task that mitigates symptoms of a disability for the handler. So a therapy dog can go into a room and take care of everybody else in the room like they would in an elementary school or a hospice center. A service dog is there for the person holding the leash exclusively. So we train tasks that help these veterans in different areas of their life. We teach some physical assistive tasks, and then we teach ones that help more with the psychological aspect, I'm going to say. So each one of our dogs goes out the door with a push, a tug, and a retrieve skill. So we use push for closing drawers, pushing buttons, handicap access panels, and things like that. Tug allows dogs to tug a door open, work one of those tricky handles that's kind of a lever action where they have to pull it down and then tug the door, pulling laundry baskets, and they can retrieve small objects like your credit card, your keys, your purse. We've taught dogs to retrieve a specific pouch that oftentimes contains medicine. We've had a couple of dogs that we worked specifically with to retrieve an item that wasn't very big, but it was very crucial for these veterans because they had a spinal stimulator which helped them control the pain levels. So if the veteran was going into a lot of intense pain and they couldn't quite get to this piece of medical equipment, they could send the dog by cue word to go get it and bring it to them and hand it to them. So things like that have been really helpful for different needs that you have in the home, for veterans who are in a wheelchair, who have back and shoulder injuries. It's just a large gamut of things that those dogs can really be supportive with these skills. And above and beyond that, we teach, like I said, skills for the psychological side. We're teaching the dogs how to do interruption of panic attacks, dissociative spells where they kind of glaze over and get frozen, interruption of nightmares, and just alerting them in general to these changes in their hormones. So we use scent samples from our veterans when they're having panic attacks and things of that nature. And they collect scent samples for us by taking a saliva swab and putting it in the freezer, and then we train the dog to the smell. So the dogs are taught how to do a nudge behavior with their nose into your thigh and how to press their chin into your leg as a rest of like a chin rest. And those are really great alert behaviors depending on if you're standing or sitting that the veterans have learned to pick up on. So if they're in public and the dog's nudging their leg, they're more aware that their hormones are changing. They might be having a panic attack onset, and then they can ground themselves, they can hold their dog. I've had veterans that will sit on the floor of an aisle in the back corner of a Walmart, kind of holding their dog and matching the dog's breathing until they've got their stability back. So it's really amazing what these dogs have learned through the skills we teach and through the natural abilities of the dog. We had, oh goodness, it was 2 years ago now, we had a little yellow lab who was so in tune, it was crazy. Our office for PAVE is actually over on Aleclec in Hillsborough area. And I was working in the office by myself, and I got a phone call with really upsetting news, just kind of the news where you sit there in shock and you're going, I just need to process this. What does this mean? And I was sitting there alone in this little office, and this dog, who was no bigger than this guy, he got up off the floor and came and gave me a really firm chin press into my thigh, and he was on there laying his chin into my thigh for about 45 minutes. He knew that my hormones had spiked, and it wasn't like I was sobbing. I was just really trying to process what it meant to have a family member get diagnosed with cancer. He was also a dog who would do a chin rest from the back seat when I was driving 26 in rush hour traffic. I was like, okay, I might have a little stress. So the things that they can pick up are just phenomenal. We teach scent, we teach awareness and bonding, but we have a dog in Washington that's picking up on migraines. We didn't train that. It's a skill he learned watching his veteran, figuring out, oh, this predicts this, I can help, here's what I do. And then the veteran's going, oh, this happens reliably. Then the veterans are calling us going, my dog's figured out something new. I'm like, well, that's awesome. That's fabulous. That's what we're aiming for, that the dogs fill in the gaps with the skills we teach. So there's just so much to that. And of course, we're looking for veterans who are really stable and ready. So to touch briefly on the veterans we end up working with, we have a very strict criteria because, as you know, everybody has a different healing process, different disability levels. Some people are more and less willing to do the work and say they need help. Some people don't want instructions, and because we're an ADI accredited group, we're with our clients through the life of the dog and into a successor dog. So they're stuck with us for the long haul, which means we value those relationships really highly. So our veteran clients have a whole gamut of things they have to meet, but the highlights are that we need them to be in treatment and making progress toward healing. The dogs are not a standalone intervention like taking a magic pill. It really works well in connection with a good therapist, in connection with sometimes medication, in connection with getting out of their homes, being willing and eager to get back out into the community, even if it's just going to Safeway without their significant other going with them. We really look for people who are trying to get that next step and that stability. We're also looking for people who are not actively suicidal. And that's been a hard one because these dogs are proven to be an incredibly powerful tool against suicidal ideologies and behaviors. They reduce a lot of the symptoms that lead down that path, and they give veterans a reason to get out, they give them a reason to live, they give them structure. And so I tell people at the VA, like, this is not a red zone intervention. This isn't somebody calls you on the suicide hotline because they're about to do something terrible. You go, here's a dog. It's something where we need more stability. We need to know the dog is safe. We need to know that our staff is safe when they do a home visit and do follow-up work. It's something that helps on that road, but it's not an immediate fix to somebody who's in crisis. And we've had veterans that have done amazing work when they've had rough spells. We've had a few times where we had veterans that needed to do some inpatient electively, and we assisted the family if they needed help. caring for the dog for an extra week or something if it was too much for the significant other and the children, and just seeing what needed to happen there for the betterment of everybody. But we don't want to demonize anybody for needing mental health care. That's the business we're in. We're trying to be really sincere about it, really genuine, and support them and their dog. Our veterans also are required to have an honorable discharge. I've learned a lot more about that in the last 6 years, but that's just not something we've been able to budge on because it means so much as far as somebody's safety and reliability, and also just a general ability to follow directions, as I've seen for some veterans. We also need them to have a safe workplace and willingness and ability to attend training camp in Portland. So our team training camps are really something. We do a lot of one-on-one for our application process. It always starts with a phone call with Cheryl, usually, who coincidentally is my mother. And she's really good at getting to the heart of what veterans need, because not everybody's a great candidate for a service dog. Some people don't know how much work it is. We've had some phone calls with veterans who are just not really in position to care for themselves and a dog and take the financial responsibility. And some of them need an emotional support animal, and some of them don't need a dog at all. So it's been really good to talk to people and be able to steer them a little bit and see what they need. Because if you've got seizure issues or blood sugar issues, those are both very life-threatening situations, and they're much more complicated than just a service dog that does primarily PTSD and anxiety work. So we don't train for seizures, and we don't train for blood pressure, diabetic alert. So we do a lot of referring people to an appropriate venue just to make sure everybody gets the best help they can. But as they go through our process of applying, it's very one-on-one. They do all of their training receiving the dog one-on-one, usually with Cheryl, so they have the same trainer throughout. We all have a close relationship, so I can call almost any veteran that we've placed a dog with, and I almost across the board know the significant other's name if there is one, know approximately how many kids they have if there was another dog in the home, you know what part of town they're in. Having a small staff has made that really possible. And right now we have 25 active graduates working in the community with their dogs. So it's quite a family. But as we do our training camps, as I said, the dog is already trained when the veteran comes for camp. So the veteran comes, and if they are from out of town, they usually have to get a hotel room because it's about a 2-week process. They meet with a trainer about 6 days a week for 2 weeks and do a lot of training, a lot of rapport building, and then they start working out in the community at their comfort level. So there's a training space they use that's very quiet, very purist, so there aren't distractions and there's no overwhelm, no crowds, but we have to get the veterans out into the community, whether that's going to Office Depot right before they close, or a veteran who's able to handle Costco during camp. We've had veterans that wanted to go to Cabela's and got halfway through the store and said, I can't do it, I need to run back outside. They got their breath, they grounded with the dog, and then they wanted to go back in. So we just work with them and where they're able to be successful and comfortable, so that when they do graduate with their dog, they feel home free, that they could go into Walgreens, they could go into Winco, they know what to expect, they know how to cue the dog, they know what the dog's going to do for them. But it's a process. It's really a process. Each veteran gets about 40 hours or more of private training when they receive their dog. They also get a lot of gifted supplies to take care of their dog, because we'd like to provide those gift bags. So because of our ADI accreditation, we have a lot of follow-up guidelines. We have a lot of guidelines in general, but we are mandated to require veterans to do frequent check-ins. At minimum, we do monthly follow-up check-ins for the first 6 months, and annual home visits and recertification tests. And that becomes a little bit daunting with this many teams, but it's phenomenal work, because when we go and do a home visit with a veteran in Walla Walla, we can see all these different things that maybe they need some refresher training before we take the test, or maybe they need to update us on new life happenings or new people in their life, or a new baby that was born. There's all these different things that happen over a year. And so you can talk to somebody on the phone or over texting, and you only get a snippet of the information, but when you see them in person, then it all comes to light. Then you can see, okay, we need to work on getting the dog's nails a little shorter. We need to see if this veterinarian is really the best fit. We need to get ready for the test. We need, and we do so much follow-up. Because our goal is that the dogs go into the community, they're clean, they're healthy, and they're professional. And the veterans know how to cue the dog, how to navigate the public, how to be polite and appropriate when somebody questions if it's a real service dog, or asks, what's wrong with you, instead of being very knowledgeable about HIPAA and what isn't an appropriate question. So we do a lot of education from start to finish about here's how to cue, heel, and sit, and here's how to get on an airplane, and here's how to go through TSA, and here's what happens if your dog has an emergency, or the VA has a question, or your workplace has a question. We're kind of a one-stop shop. We do a lot of fielding of different questions and information. Because of that, I would like to say we kind of have a 24/7 support staff. So our big goals for the future for PAVE, we're on a very strong point here, because we've gone 10 years. We're a very strong program, but we're very limited by our space currently in Hillsborough. And Dr. Nelson was very adamant. She's like, okay, we need to be able to share this information and just reach everybody's ears if anyone has any suggestions, ideas, or knows somebody, because we're really trying to grow and go to the next level for the stability of the program, long beyond the next 10 years. And so currently we have a rented office, which does not provide us enough space for our administrative offices, really is not a sufficient training space anymore. And we're looking for a property that we can purchase to build what will be a service dog facility for PAVE. Some of the great things that we're hoping to do with that are to have enough acreage that we can house not just the administrative offices, albeit there aren't many, but that we can also have veteran dormitory rooms, because that would alleviate the need for a veteran to come to town and spend 2 weeks in a hotel at their own expense. And so that's one of the things that's very much on our docket, as far as how we serve our veterans better, how we provide a longer lasting footprint in the community, a place where we can host these community groups that want to help volunteer, that want to come do fundraisers, and give this really the financial longevity and stability that it deserves, so that we can continue to serve these veterans to the best of our abilities. As I said, our dogs don't have kennel situations. Certainly they know how to go into a dog crate and things like that, but we don't have a barking, crazy overflow of dogs. But we are looking for a way to integrate into a community, and primarily we've been looking at Washington and Yamhill counties to see where we can make our forever home as a program, because it's such a unique thing that we serve these veterans with these amazing stories and very challenging problems that they face on a daily basis. This would give us so much more to offer in terms of people coming and doing drop-in visits to do refresher training, or to come and stay for a few days and do their recertification test and not have to get a hotel room and things of that nature. So that's really our next step as a program. We're working very hard around the clock to get caught up after spending a couple months with the COVID restrictions. We're starting to get back out into our communities with social distancing and masking, and the veterans who are strong enough, healthy enough to go out. Certainly some are more immunocompromised and need to stay more isolated, but it's been an amazing 10 years. We've grown so much, and these dogs are incredible. The 5 dogs in training right now are fabulous. We have a camp lined up in about 2 weeks for a Forest Grove veteran, which we're really excited about. And I work personally with his dog, so I think they're going to be a great team. And then we get to tie the guide dog puppy raisers who volunteer to take care of these dogs as little infants, and they get to meet and communicate with the veteran recipients. So we make it full circle, and everybody gets to learn more about the service of these amazing people, the challenges that they face on a daily basis, and have more awareness of what this population goes through and what the dogs can do to support them. So it's kind of the full gamut. I know I talk fast, but there was so much I wanted to share. I am open to any and all questions. And yes, Bryce, I will absolutely make sure you've got this presentation, because that just didn't work quite as quickly as it could have.
When you train service dogs, do you do treat training or click training or toy training?
We do a lot of treats. We use clickers when we're teaching a brand new task, but we don't want the veterans to have to worry about how to click and timing, and it can go badly really quickly. So we teach them how to do a verbal yes and a lot of praise. These pups actually end up working for a lot of their meal allotment. So I'll give him maybe half of his breakfast and his bowl in the morning, and then he works for the rest during the afternoon, and it helps build a good relationship and keep him super motivated.
Where do you get your funding from?
Because we're a 501c3, it's all grants and private donations. So we thrive on our community members that support us, whether it's CrossFit gyms and small businesses and private foundations. We've got a government grant that's supported us a lot over the last couple of years, but I can personally say we'd love to diversify and get to know more people on the ground who want to support this organically, because you can't trust a federal grant will always be there. Got to grow above and beyond it. And it's the men and women like Rotarians, like Lions clubs that hold the glue of civilization together. You know, you've got to know your community. That's where the strength is, not in grants from different organizations.
Thank you.
How long can a service dog be a service dog?
So these guys have a good working life. We do really holistic veterinary care and vitamin supplements and things like that. So they don't need a lot of extra veterinary intervention like dental cleaning and sedations. So we keep them really lean, really healthy and strong. We've got a dog right now that I want to say is almost 9, and he's still working really well for his veteran in Vancouver. We've had a couple that we retired, but so far in 10 years, we've only retired 3 dogs, I believe. But we just kind of tell the veterans, you know, you need to be a good judge of this. The dog can stay with you after retirement if you've got a home and you're, you know, in a place where you can manage having a successor dog and your retired service dog. We don't want to take anybody's dog away from them, but we'll give them homes in our organization and our people if we need to. But as long as the dog can keep up with their lifestyle and is happy and healthy to do it, we don't have a problem with the dogs keeping, you know, their working life going into 10 or 12. It just depends on how the dog's really feeling about the get up and go, you know.
Well, thank you.
Are the dogs a gift to the veteran, or does the veteran have to buy the dog?
The veterans don't pay a thing to get the dog. We don't ask for an application fee, which I'm seeing more service dogs organizations are charging application fees. They don't have to do any mandatory, you know, under the table fundraising or anything like that. We do ask that they're responsible for the veterinary care and the food and supplies after placement, but we send them out the door with probably close to $2,000 of supplies now, if I had to guess. But there's a VA benefit that pays for all of the veterinary care, emergency and preventative, and anything prescribed by a veterinarian, which is amazing and saves them thousands of dollars over the course of the dog's life and works for a successor dog. And I coach our veterans very carefully on how to advocate for themselves to get that benefit, because once they receive it, they're set for life, and the VA will cover everything, immediate reimbursement. They don't have to even put it on a credit card. So we try to support them with everything we've got so that they've got the resources. They know which veterinarians are more affordable and work with us and give us discounts and things like that.
How are veterans finding PAVE, and is there a waiting list?
So that's a great one. A lot of the veterans are finding PAVE through the VA. I worked really hard to network with Portland VA, Eugene VA, local vet centers, county VSO offices. About a year and a half ago, I just hit the pavement and I went to anything I could get my foot in the door to share with the providers. And because our application process involves a provider referral form so we can communicate with their treatment team, the providers are more aware of what the dogs are trained for, what they help with, what they don't help with. So the providers oftentimes will refer multiple veterans year after year. Sometimes they're not the best applicants, so we have to coach the providers on what we need from our applicants. Some of them find us online. We've had some that found us from KGW interviews that I did a couple years ago too. So there's a lot of different avenues, but I think the VA has been increasingly positive, especially Portland, VA. There are definitely sites like Roseburg that I can say need a little more education, and the providers are not quite as warm to the idea. But we've got veterans down here that are advocating and showing the providers what the dogs can do. And there was another question, and I forgot it. I apologize.
Oh, is there a waiting list?
Yeah. So sometimes we do have a wait list. It really depends on the season, the year, and who's applied. We only place about 5 to 6 dogs a year. So we don't aim to do large numbers, and I don't think Michele Nelson's ever going to want to do 20 dogs a year. We don't have the staff, and we wouldn't have the intimate knowledge of our veterans. So right now we have 1 camp scheduled, and we have a couple applicants that we're waiting to see who's really ready to go. Sometimes veterans fill out an application and then don't contact us again for months. And so we kind of have to go like, you know, if you applied, we need to get a dog to you hopefully within a year, because we don't want to do a new application because of all the things that have changed. So we try not to keep a really long wait list. And if we get phone calls for somebody who clearly needs something that we don't provide, we refer them on to a better organization right away so that they're not waiting. Because if you've got a need, we want you to get service, not just sit around and wait for your number to be called and then, oops, this isn't really right for you. Too bad.
How many trainers do you have?
Right now, there's only 3 of us. We had a 4th, but she took a job with another organization, which, you know, people change their paths sometimes. So Michele, Cheryl, my mother, and I are all certified professional dog trainers with more continuing education requirements than we care to count. I can see in the future we're going to be looking for more staffing. I really think that that's going to need to happen. But right now, without the office space, there's really no place for more training and more offices to happen. So we're kind of limited by that right now.
Based on something that you said earlier in your talk, how do you train a dog to fetch a credit card?
That's a great one. It's challenging because credit cards are hard to pick up. So we start with all of the dogs, just seeing if they'll accept opening their mouth, which is quite a challenge because from the guide dog program, oops, don't fall off your chair. From the guide dog program, the dogs are taught at an early age, you don't touch anything. You don't touch anything with your mouth. You don't pull a tissue out of a wastebasket. You don't chew a leaf or a pine cone. And so even this guy, I was really worried about him. I have to tell you, I spent 2 weeks with him with a little plastic dowel just going, will you open your mouth? And he just go, won't do it. Can't trick me. And one day he finally started trying. And sometimes it's just sitting there going, just trust me, nothing bad's going to happen. We don't do punishment. We don't do leash jerking. We don't scream at the dogs or any of that craziness. So it's for the dog to have the confidence to go, okay, let me try this. Let me trust you enough to try it. And then, of course, treats rain from heaven. So it's a lot of progression between getting them to accept holding something with a little pressure under their chin just so that they can get the idea that they're holding the weight. And then we progress on different items. So normally we do like a little cloth bag. I work with a little leather keychain that doesn't have keys on it. We progress with the keys. We try some remotes. Credit cards usually a bit further down the line as they get more comfortable trying to put their mouth on something unusual. But it takes months sometimes for these dogs to get comfortable reacting with their environment, because from guide dog training, they don't touch anything. They just know to make decisions about traffic, stairs, slanted sidewalks, and to walk forward. You know, it's pretty simplistic when you ask them to do things like that, but we need a lot more interaction with the environment and eye contact. Guide dogs don't make eye contact, so that's another training piece.
Well, we have the steak feed and the Concord d'Elegance. And from what I understand, we are allowed to ask 2 questions as to whether or not a guide dog, service dog, really is a service dog. Can you go over those for us?
Yes. It's been a while since somebody asked me those questions, but I believe they can ask, is this a service dog? Which everybody's always going to say yes. So the tricky one, The way you get around that is you can go further. You can say, is this a service dog trained to do a task to mitigate a symptom of your disability? It's a mouthful, but that really kind of corners somebody if they're lying about it, because no one wants to be stigmatized as disabled. And so people who have legitimate service dogs are much more happy to say, yes, thank you, because that means, you know, Aunt Sally with her Pomeranian aren't going to show up. And the other one that if I recall, it was what task is the dog trained to provide? Now I'm questioning myself.
The two that I heard were, is this dog trained for a specific disability or injury? And the second is, what specific task does the dog provide? What service does the dog provide? Is it, you know, it's like they would be happy, like you say, they would be very happy to say, yes, the dog is a dog that alerts me for different things.
I think you're correct that the second one is, what task is the dog trained for?
Right.
I think that's what I've heard. And if I remember, that's the HIPAA compliant way to phrase it. And of course, it's always kind of hard. Like if I get that question with him, like, well, I can say he's a medical alert dog because he alerts to panic attacks. I can say he's a physical assistive dog because he'll pick up my purse if I drop it, or pick up the leash handle. Like sometimes you have a lot of things you can say, but you're only required to give one. So we oftentimes tell the veterans, don't even bring up PTSD because that's subjective. Give somebody the short and quick answer of something that's tangible that they're not going to argue with, just to make it easy on yourself, because you don't have to tell them your life story. You don't have to tell them your disability, you know.
Okay, thank you.
Well, thank you so much for your program. I had actually not heard of it, and it sounds like it's really helping people. I also didn't know you were so local. So that's really a great resource. And we'll definitely post this information in our newsletter, and that way, you know, it'll reach more people, and hopefully we can find some support for your organization. I'd love to hear more about puppy raisers too. That sounds like a fun thing to be part of. So thank you so much.
No, thank you for having us. This is just, it's wonderful to be able to visit with everybody, even over this distance and coronavirus, but we're so grateful to be able to talk to, you know, our local groups. You guys are just wonderful, and I'm really grateful for the opportunity. So is Scout, he's just less enthusiastic.